All right, very good. Well, am I allowed to go? Good, very good. Good morning and welcome to the Pennsylvania Insurance Department's public informational hearing on Highmark Health's request for modification of the department's 2013 order that approved Highmark Inc.'s proposed change of control and affiliation with the West Penn Allegheny Health System. I'm Mike Humphreys, Commissioner of the Pennsylvania Insurance Department. As Commissioner, I will make the ultimate decision regarding Highmark Health's request for modification of the order. The purpose of this hearing today is to receive comments from interested persons to aid the department in ultimately reaching a decision on the request. This is a public informational hearing similar to a town meeting or city council meeting. The entire record of the request, including transcripts of this hearing, will be considered by the department before any final conclusions are reached. The department will closely consider any comments about the request presented here today, along with written comments that have previously been submitted. No final decision will be rendered immediately following the conclusion of this hearing. Department staff responsible for helping with the review of the request are seated with me today. To my immediate right is Jody France, Chief of Staff for the Insurance Department. To my left is Deputy Insurance Commissioner Diana Sherman from the Office of Corporate and Financial Regulation. Also in attendance are Margaret Guerin Calvert and Susan Manning from the department's independent economic consultant, Compass Lexicon. The department's Chief Counsel, Kathy Speaks, is in attendance, as well as outside counsel to this matter, Gary Beezer and Bill Gramlich from Blank Rome. The publicly available record thus far consists of all public documents related to the request, including those filed by Highmark Health and its consultants, the reports of Compass Lexicon, and written comments received from the public interested persons, and any responses to those comments from Highmark Health. The request for modification and related public documents, including reports prepared by Compass Lexicon, have been and will remain available on the department's website, www.insurance.pa.gov. As for the format of today's hearing, there's an agenda on the table at the entrance. We'll begin with presentations from Highmark Health and then from its economist, Dr. Corey Capps of Bates White. This will be followed by presentations from the department's consultants, Compass Lexicon. These presentations will be limited to 15 minutes. After this, the public comment portion of the hearing will begin with presentations from those who have registered to speak. If you have not pre-registered and wish to speak, please see Ms. Karen Rodriguez at the registration table so you may be placed on the speaker list. The registration table is in the back corner. Individuals participating in the public comment portion of this hearing should limit their presentations to 5 minutes or less. Additional written comments will be accepted after the public hearing. I'd like to take a few moments to review the procedures and ground rules for today. I will be calling each commenter to the front table once that individual's turn to present. When speaking, please indicate if you are speaking on your own behalf. If you are speaking in a representative capacity, please identify your role and relationship to the represented organization. Please address your comments to me and the panel in the front of the room. Your remarks should be specific to the request for modification of the 2013 order that is before the department. Because of the nature of today's public informational hearing, cross-examination or interrogation of speakers will not be permitted. However, you may pose questions to Highmark Health during your presentation. Following today's hearing, the department will require written responses from Highmark Health to questions raised by both the department and the public during this hearing, and we will make those responses available on our website. Please note that today's hearing is being recorded, and we have a court reporter present today to prepare a transcript of this hearing. In addition, the hearing is being web streamed live, but with only viewing capabilities. The web stream will be available on the department's website after today's hearing. Before we start, I just want to ask everyone to check and make sure that your cell phones are on mute so as not to interrupt the hearing. With that being said, Mr. David Holmberg, you may come to the table and begin your testimony on behalf of Highmark.
Good morning, Commissioner, Deputy, everybody. So I'm David Holmberg. I'm CEO of Highmark Health, and I appreciate the opportunity to speak with the department this morning in support of Highmark Health's request for modification. I'd like to focus on three things. First, in the 2013 transaction that created Highmark Health. Second, Highmark Health's business model and financial strength as a blended health organization. And third, the current state of competition that Highmark Inc. faces. My aim is to show the department, starting from the uncertainty surrounding the 2013 transaction, Highmark Health has navigated the marketplace to a position of strength as an integrated system that's incentivized to deliver high-quality care at reasonable cost. I ask that Highmark Health and Highmark be restored to an equal playing field with other integrated systems so we can deliver on our mission for the benefit of our members and the Commonwealth. Over the last 10 years, Highmark has transformed from a successful regional insurer into an innovative, diversified healthcare organization with comprehensive solutions and national impact. Our living health model in Western Pennsylvania is proving that we can integrate health, coverage, and care with positive impact for our members and the community. As a blended health organization, Highmark Health operates a health system, the Allegheny Health Network, through the lens of a large health insurer, with a focus on reducing current and long-term costs of care by enhancing health outcomes and quality at every step of the patient experience. In every part of our business, the most important proof point is that people are choosing our products and services because we deliver what they value. In my role, I focus on Highmark Health's future and on executing the blended health care model that has served our members and communities so well. For our discussion today, I'd also like to look back at why and how Highmark started on this path. More than 10 years ago, Highmark entered the transaction with West Penn Allegheny's health system that formed Highmark Health and eventually Allegheny Health Network. The transaction came about at a time of uncertainty for West Penn and our community. In the years leading up to the transaction, West Penn suffered deepening annual operating losses and relied on cash advances and financial support from Highmark to stay afloat. Despite Highmark's support, West Penn continued to face grave operational and financial difficulties. West Penn employed more than 10,000 people, operated 5 hospitals, and had hundreds of millions of dollars in unfunded retirement obligations. All of that was at risk. To meet community needs with high quality and affordable health care, save vital healthcare jobs in institutions, as well as the economies of their local communities, and sustain healthcare competition, Highmark agreed to affiliate with West Penn. Highmark ultimately launched Allegheny Health Network and formed Highmark Health as an enterprise that strategically aligns our health insurance, provider, and diversified businesses. As the department well knows, the approving determination and order was entered on April 29th, 2013, and the transaction was permitted to close. Highmark respects and appreciates the department's handling of the order and the process that led to its implementation. The order, of course, contained conditions designed at a time of uncertainty as to whether Highmark would ultimately be able to achieve the strategy of creating a thriving integrated payer and provider system. The conditions were primarily intended to ensure that, first, Highmark remained financially stable so that the insurance assets in the Commonwealth would be protected against the concern of wasting those assets on a failing provider system unable to be rehabilitated. And second, competition would be preserved in the region. The current state of Highmark Health's finances and of competition would have been difficult to foresee amidst the uncertainty of 2013. But now it's clear that much has changed. Highmark Health continues to be a financially stable participant in highly competitive markets. In this new landscape, Highmark should be relieved of the outdated conditions, permitted to abide by its independent legal obligations, including to the department. I'll now discuss the current state of Highmark's finances and the competition it faces. Today, Highmark Health is a financially strong integrated system. During the last decade, Highmark Health's annual revenue grew 72%, from $15.8 billion to $27.1 billion. AHN's annual revenue more than doubled, from $2.2 billion to $4.7 billion. AHN has also produced approximately $1.4 billion in accumulated EBITDA that was used for its operations. And Highmark's health plan membership rose 32%, from 5.3 million members to about 7 million. The financial rating agency's comments about Highmark affirm our strong financial position. AM Best stated that Highmark's excellent ratings reflect its balance sheet strength, which by the rating agency's assessment is strongest, as well as its adequate operating performance, favorable business model, and appropriate enterprise risk management. According to S&P Global Ratings, the stable outlook reflects the agency's expectation that Highmark will maintain its leading commercial market positions and profitability in line with similarly rated peers and sustain excellent capital and earnings. And Highmark's key rating strength includes its Blue Cross Blue Shield brand equity, its leading commercial market position, and geographic diversification in 4 states. And, by the way, the diversified product portfolio across commercial and government product segments. In reaffirming Highmark's stable outlook, Moody's praised the organization's success in integrating its affiliated and non-affiliated hospital networks within its expanding health insurance footprint, and shared an expectation that enhancements currently being made by Highmark to its integrated model, alongside with technological advancements to drive cost efficiencies and quality improvements, should lead to continued enrollment gains and drive non-insurance earnings diversification. Highmark's financial strength underlies another aspect of our story that I want to emphasize: Highmark's commitment to serving the public interest by strengthening local communities. This commitment goes beyond providing affordable, high-quality care. In 2023, for example, Highmark Health provided $225 million of corporate giving, including uncompensated care at AHN, and funded another $826 million of capital investments. Highmark's financial strength allows us to keep this commitment to the community. Highmark Health's track record of success and stability since 2013 shows that the certainty that gave rise to the conditions has been replaced by a strong foundation and sustainable business model. The department's concern that Highmark might be putting valuable insurance assets at risk in the acquisition of West Penn has been answered by Highmark Health's current financial strength. The preservation and strengthening of AHN as a provider in Western Pennsylvania's market is a critical factor in the Highmark Health overall financial strength. Highmark, particularly, remains on solid financial footing in the eyes of the department. Our risk-based capital is more than sufficient under the department's standards. Strong financials, long-term stability, and relentless focus on the millions of people we serve have been essential to the transformation and growth we've achieved in the past decade. They will continue to shape our transformation and grow in the decades ahead as we continue investing in innovative programs and technology, in digital and brick and mortar infrastructure in our communities. In addition, Highmark Health currently operates in highly competitive markets. There has been a clear increase in competition on the insurance provider sides since the order was introduced in 2013, as Highmark has shown in its submissions. New and existing insurance competitors have introduced new products in an ever-changing competitive environment. Highmark has responded with innovative products that fit its integrated business model. Our Together Blue health plan is a leading example. High satisfaction rates have made it the most popular Affordable Care Act product in Western Pennsylvania. The number of people choosing the plan doubled between 2021 and 2023. In this intense competitive environment, customers and consumers choose Highmark because of access, affordability, and quality, but also because of everything we do to ensure an outstanding consumer experience. On the provider side of the market, AHN improved access to care and maintained strong quality of care. This is a stark change from West Penn's dim prospects prior to affiliating with Highmark, and the very real possibility that Western Pennsylvania would be left with a single dominant provider. With respect to access, AHN has, among other things, created 6 multi-specialty health and wellness pavilions and 6 outpatient centers. We've also reopened the West Penn Hospital Emergency and expanded inpatient care, and opened 7 new cancer centers, including a major new academic and research hub at Allegheny General Hospital. AHN's quality metrics are strong across the board. These and other expanded services at AHN serve as a critical community need during the COVID-19 pandemic. AHN provided much needed bed capacity for patients hospitalized with severe COVID-19. AHN has also been recognized for its exceptional quality of care. Name just a few of AHN's successes in 2023. 2 of AHN's facilities received Press-Gaining Guardian of Excellence Awards for patient experience. That puts them in the top 5% of the more than 40,000 healthcare facilities across America. 5 AHN facilities received Leapfrog's highest A grading for patient safety. Allegheny General became the 4th AHN hospital to earn the prestigious Magnet designation for superior nursing and patient care. And U.S. News and World Report ranked AHN West Penn Hospital's OBGYN program as best in our region for a 2nd straight year. As you can see, a lot's changed since 2013. In this dynamic and competitive environment, our request to the department is that Highmark be treated like other integrated systems. The department's order allowed for the formation of Highmark Health and paved the way for Highmark's activity throughout the last decade. But it was not intended to be immutable or permanent. The order contained a process for its own modification, and Highmark properly invoked that process to ensure that it's subject to a fair and appropriate regulatory environment. Since the order was entered in 2013, no similarly situated organization has faced such extensive oversight from the department. In 2013, the 2013 order costs us and our stakeholders, solely in paying for the department's outside consultants, more than $2 million per year, amounting to over $20 million in the last decade. This does not include our internal costs of compliance, including the cost of our consultants. Other integrated systems do not face those same costs. The extensive conditions not only impose a unique burden on Highmark, they're also unnecessary. As we explained in our request for modification, many of the conditions are addressed by other laws, regulations, or are now obsolete. Highmark takes its legal obligations seriously, and the department and other regulators have ample authority outside of the conditions to ensure that Highmark abides by these obligations. Ultimately, what Highmark is looking for, supported by the current state of competition in Pennsylvania, is to be regulated like other integrated systems. Similar conditions imposed by the department are not applicable to similarly situated integrated systems, with one recent exception. As of March 27th, the department imposed certain competitive conditions on Geisinger in connection with its affiliation with Kaiser. Those conditions are far more limited than those Highmark endured. Importantly, those conditions were designed and implemented to deal with present facts and circumstances surrounding that transaction. Highmark's conditions may have been right in 2013, but they're not right for today. Several other large integrated systems with which Highmark vigorously competes face no such regulations. The department should avoid piecemeal regulations of integrated systems that favor some systems or others purely on the virtue of when and how they were affiliated. At this point, there can be no doubt that Highmark continues to be a very strong, financially sound health insurance company, and that health care competition in Western Pennsylvania has been enhanced following the creation of Highmark Health as a blended health organization. Highmark Health has preserved competition for healthcare services in Western Pennsylvania, and it's enhanced the healthcare jobs market in Western Pennsylvania and maintained broad access to hospitals for Highmark members and others, all while reducing the cost of care and maintaining its financial strength. For that reason, the conditions have served their purpose. The conditions made sense. They were implemented in 2013, and Highmark Health's future as a blended health organization was uncertain at that time. But that uncertainty in 2013 has been replaced by an 11-year track record of success for Highmark Health and of increased competition for the benefit of Pennsylvanians. Highmark Health and Highmark Inc. will remain subject to robust oversight from the department, the antitrust laws, and other regulatory obligations, ensuring that Highmark remains a viable health insurer in the Commonwealth of Pennsylvania, subject to the same regulatory regime as its integrated competitors. We're very proud of what has been accomplished on behalf of the consumer in the last decade, and we firmly believe the remaining conditions of the order should respectfully be lifted. Thank you, Mr. Commissioner.
Thank you, Mr. Holmberg. Number of questions for you. Other than the payment for the department's oversight and Highmark's cost of compliance, what examples can you provide of Highmark or AHN being competitively disadvantaged by the conditions in the?
I would say respectfully, it's anything that creates an uneven playing field. When we think about our largest competitors, they don't have the regulatory review, some of the competitive limitations that we have. So as we build for the future, we believe that there's opportunity as an integrated health system to be even more competitive, deliver better care for the people we serve. And we're asking that anything that would be a competitive disadvantage be eliminated.
Because when I think about it and some of the conditions in the order and what Highmark's plans would be, when we talk about the contracting practices currently prohibited, most favored nation, anti-tiering, anti-steering, exclusive contracts, what would be your plans to engage in that sort of contracting if the conditions go away?
Well, we certainly support an open and playing field. We would support conditions that make it more competitive versus less competitive. We think that part of our success has been families have chosen us and businesses have chosen Highmark, because we put better products and services in the marketplace. And so our intention would be to continue to refine the product service we do on the insurance side as well as the healthcare delivery side, but we would do it in an open way.
In a number of the other provisions talk to firewalls, which is not uncommon with some of the largest health mergers we've seen nationally. If those were eliminated, would Highmark plan to maintain the firewalls and the firewall policies required by the condition?
So we would comply to all antitrust laws and the regulatory environment that's out there. Absolutely. We believe that those are essential and that we appropriately, will respond to them. We talked a number of times about AHN and its growth over the last 10 years. If you look at the last 5 years, publicly available financial statements show net transfers from Highmark averaged $276 million a year, totaling more than $1.3 billion. Do you expect the net transfers from Highmark to AHN to continue at a level of 200 million plus a year? So when we think about, how we go to market in Western Pennsylvania, Highmark is an insurance company. We think about, it is an integrated approach. And so the investments that you described were made on behalf of Highmark members to build the capabilities that we felt were needed. So, we anticipate we will continue to be supportive because we look at the integrated economics So, the profitability, if you want to call it that, of both Highmark and AHN combined in Western Pennsylvania and the footprint we're in. And what that does for us is, in our case, it was very clear that we saw that there was a void in the cancer space. And that's why we invested, Highmark did, in cancer centers that gave our members access. Same thing for why we built the West Penn, the West Penn OBGYN programs. There was a need for the members to have better access to care, to improve quality of care, those kinds of things. So I would anticipate that we will continue to make the appropriate investments, but they'll be in the best interest of our members.
So then, could AHN currently operate independently without relying on direct cash or contributions from Highmark?
I think AHN has done very well in improving quality, safety, access, and affordability, and that's been a combined strategy. I suspect if we did not do anything on the Highmark side, we would, have a different relationship. It would be more contractual, and it could lead potentially to higher costs for the region for all healthcare providers. So since AHN has, become part of Highmark, that was created, we've been able to slow the cost of inflation in terms of healthcare. And I think you'll hear from the economists that there's real data now that shows the impact we've had on that. That's part of our go-to-market strategy on the insurance side. So we don't see where we would want to disconnect it, because it enables us to be more affordable on insurance pricing, premium pricing, things that we do in the marketplace to create an overall competitive environment.
So then there wouldn't be a plan or a date expectation at which it could independently operate financially.
We see it as an integrated platform. When I think about the economics, I think about both insurance and the delivery systems, including AHN, as one combined entity.
And you also mentioned our recent Geisinger Rising order, and how those provisions are more limited than yours. I'm curious if you would object to Highmark being under the same limitations as Geisinger and Rising.
Well, the first thing we would respectfully ask is that, that we be relieved of the 2013 conditions, and we're certainly open to a conversation on any conditions that are applied equally across the board. So for all integrated systems, where, there's both an insurer and a payer.
Because a lot of the provisions or conditions that I mentioned earlier, the contracting, the firewalls, those are all applicable in the Geisinger Rising sense. Not so much necessarily the payment for departments oversight, but a lot of the substantive provisions were intended to be the same as we tried to look at it and how we regulate Highmark, for example.
So we're very comfortable with a fair and level playing field. I mean, we've had 10 years of operating under the conditions, and I think we've proven that we can not only comply and do what's appropriate, but deliver on the promises that we made. I assume that the conditions associated with Geisinger related to, the situation there and, who their parent will be, versus, who we are. I would just state that, we're very comfortable with provisions that, that apply to all.
And kind of moving off that for a moment, and this is a question, I mean, you're first, so you'll get it, but everyone behind you will also get it. And it's just anecdotally.
That's good, puts more pressure on me now.
I've heard from a number of insurers that looking to enter the Western PA market, that it's a significant challenge, more challenging than most states or most markets in many other states. They say particularly difficult to get into the Medicare Advantage space and to get contracts with provider groups in Western Pennsylvania. Just curious, kind of your thoughts on that complaint that's coming to me, and any commentary you'd like to share in that.
I mean, first of all, as you know, we're an open system at AHN, and we work with anybody who wants to work with us. At the same time, Highmark was instrumental in building, the capabilities that make Western Pennsylvania attractive to other insurers. And those resources, came from the people of Pennsylvania and the Commonwealth. As people from out of state want to enter the marketplace, we think that they need to pay appropriate rates and be appropriate in terms of investment in the region, just like we have been. But I think that you have two very strong competitive integrated systems in the West, but you also have a number of insurers who operate in the West. And I think what we always look for is, people entering the market, are they willing to invest in the communities? Are they willing to do the kinds of work that we're doing with the $225 million last year that we put into uncompensated care and shoring up, the various neighborhoods, the social determinants of health and those kinds of things. That's a different position than maybe what some of them, want to do. But we do think that's part of the reason why it's a competitive market, because you have to show up and be part of the community.
Any questions? No? Okay.
Okay.
Thank you very much.
Thank you very much. Thank you. Appreciate
Next, we will have Mr. Capps, Corey Capps with Fates Wharf. Please, again, introduce yourself and your participation.
Morning. Thank you for the opportunity to come here and summarize analyses of the evolution of healthcare competition in Western Pennsylvania over the last 10 to 12 years. My name is Corey Capps, and I'm an economist at the economic consulting firm Bates White in Washington, D.C. I spent the bulk of my last 25 years doing economic research and economic analysis and consulting related to healthcare competition in general. Today, I'll provide some evidence to support four main points. Everything I talk about today is substantiated in more detail in the written comments that I submitted about a week ago. The first point, excuse me, is that the 2013 order came about after an 18-month review process, roughly, starting with the announcement of the Highmark West Penn transaction. It was designed, as I understand it, to address specific concerns that the PID identified during the 2011 to 2013 period. And those concerns related to sort of the two prongs of the combined system now. One, concerns about the degree of insurance competition as it existed at that time. And second, concerns related to the viability of the West Penn system as it existed at that time. And it was pretty dire, and I don't think that's a controversial statement about the condition of West Penn leading into 2011. So there was a lot of uncertainty on the West Penn side and concerns about competition on the insurance side. And much of what I present today will be talking about how that has changed over time. Second main point is that imposing regulatory constraints through oversight on just one competitor among several or many is going to necessarily reduce competition to at least some degree. If constraint has no impact, then really what's the point of having it in the first place? It may still be sound policy nonetheless to impose constraint if there's specific concerns and bases that would warrant the slowing of competition. Should at that time, the concerns were, as noted, insurance competition and the viability of the AHN system. Both of those, as I will show today, and you can see in my written remarks, have changed greatly since 2013. Highmark now faces significantly greater insurance competition than it did in 2013. That's actually true for both commercial products and Medicare Advantage products, which I will get to shortly. And then second, AHN, the successor to West Penn, is today a greatly improved and stable hospital system. Next point, these competitive changes are significant in total, what's happened over the last decade. The conditions in the 2013 order were specifically crafted to address the insurance competitive landscape and the condition of West Penn as they existed in 2011 to 2013 when the order came out. If the conditions, the competitive landscape has changed substantially since then conditions that were right as of a decade or so ago are not logically going to be right for today and the future. In particular, conditions that were premised on a concern over a potential exercise of insurer market power or a lack of competition when it comes to insurance should be absent or less stringent when the degree of insurance competition is greater, as it is today. Second, conditions premised on concern over the financial viability of the then flailing West Penn system or that it might drag down the parent entity Highmark Health are not warranted when the successor system, AHN, has grown, has good quality performance, and is stable. Okay, So let me jump into some of the main findings, and I'll start with insurance competition, and I'll start on the commercial side. The main competitors to Highmark in Western Pennsylvania are UPMC Health Plan, Aetna, United, and Cigna. All of them have increased their share of commercial enrollment since 2013. Since about 2017, UPMC Health Plan has had about 25% of commercial enrollment in Western Pennsylvania, and that's up from about a little over 15% in 2013 at the time the transaction closed. If you look just in Allegheny County, where Pittsburgh is, you'll see that its share of commercial enrollment is even higher. If you look at United, Cigna, and Anthem together, they've increased from a combined Western Pennsylvania enrollment share of 10% in 2013 to 18% in 2023. So across the board, the competitors are growing. One other thing that's happened recently, and its impact is unrolling now, is the settlement of the Blue Cross and Blue Shield litigation, which was not specifically related to Pennsylvania or Highmark, but does have competitive implications. In particular, it is now allowing and will continue to allow other blue entities, think of Anthem, which now calls itself Elevance, which is the Blue Cross and Blue Shield carrier in Ohio, New York, and a dozen other states, are going to now be able to enter and compete to provide health insurance coverage to commercial customers, large commercial customers in Western Pennsylvania. And that's referring to the second blue bid provision that you can see in more detail in my written remarks, as well as the submissions from Compass Lexicon. They've also eliminated the national best efforts rule that prevented Blue Cross and Blue Shield entities in other states from offering non-blue branded products outside of their home areas. So those types of products will both be entering in Western Pennsylvania potentially in the near future. Next, Medicare Advantage. That's the privately administered alternative to the federal original Medicare program. In Western Pennsylvania, there's also been an increase for Highmark's competitors in Medicare Advantage. Aetna has actually more than doubled its share of enrollment, and it reached nearly 30% as of 2024. UPMC, when it comes to Medicare Advantage, has been over 30% in terms of its enrollment since at least 2016. United, which is one of the largest national providers of Medicare Advantage coverage, was almost out of Western Pennsylvania entirely in 2014. It has since been growing slowly but steadily and has reached an 8% share of enrollment. Overall, we've seen that this competition is benefiting seniors in Western Pennsylvania as more and more of them are choosing Medicare Advantage products over the original Medicare option. It's now up to about 2/3 picking Medicare Advantage instead of original Medicare. This has benefited all the insurers who offer Medicare Advantage coverage, basically grown the pie of enrollees that they serve. These are large changes and increases in competition, which is why I began by pointing out that conditions tailored to the conditions of the competitive circumstances of 2011 to 2013 are not as good of a fit for today. Next, I want to turn to hospital competition. I will show or explain that AHN has improved on multiple dimensions, especially as compared to the state of the West Penn system over a decade ago. It now has a higher share of discharges in Western Pennsylvania. It has more hospitals. It's improved its performance and now does well on CMS quality metrics, and it's sustainable. Focusing first on the discharge share, heading into 2011, it was discharge. The Penn system was losing discharges every year. It's the low about 10% of discharges in 2011. From 2011 to 2013, while the review was ongoing, West Penn stabilized and it just sort of hovered at about 10% share. Then for several years after 2013, AHN began to grow and increase its share. The original 5 West Penn hospitals went up from 10% in 2013 to about 15% in 2023. So that's a 50% increase in the share of those hospitals. If we add to that, the hospitals that AHN has acquired or opened, including the 2021 opening of Wexford Hospital, the share of commercial discharges is now over 20%. So overall, the initial effect of the announcement of the transaction seems to have been to stop the decline. Thereafter came a period of growth, and after that has been a period of stability where the system hovers at about a 20% share of commercial discharges and a slightly lower share of all payer discharges in Western Pennsylvania. Turning to quality, the details are in my written comments, but if you look at CMS metrics over the last decade on 3 domains, patient safety, mortality, and patient satisfaction, you'll see good performance for AHN. In my written comments, I compare AHN to other hospitals in Western Pennsylvania, as well as hospitals nationwide, and track performance over time. If we look at patient safety, AHN is tracking all the other comparison groups, and they've all improved a lot since 2016, which is good news for all of us. If you look at mortality metrics, since 2020, the AHN hospitals have actually been outperforming, meaning lower mortality on a risk-adjusted basis, than other hospitals in Western Pennsylvania, or even hospitals on average nationwide. And if you look at patient satisfaction, AHN again improved, and in 2022 and 2023, the last 2 years of available data, is outperformed the two comparison groups on patient satisfaction as well. High quality helps reinforce the growth and preserve the growth in its discharge share that I described before. Next point, and is that AHN is sustainable. I'm going to address two topics on this. One, the 2019 Highmark UPMC contract, and two, the incentives of the overall entity, Highmark Health, to continue to invest in the AHN system despite some years of operating losses, as you've discussed recently. The 2019 contract between Highmark and UPMC put the the Pittsburgh area UPMC hospitals in network with Highmark. And there was a concern at the time that would shift a lot of volume from AHN hospitals to UPMC hospitals and possibly threaten the growth and success of AHN. It is true that some Highmark enrollees began choosing UPMC hospitals when it appears that they otherwise would have chosen an AHN hospitals. Not all of that was a volume loss to AHN though, because there were other hospitals in network, and some of those members began choosing UPMC hospitals. Most of the redirection to UPMC was McGee-Womens for labor and delivery, where it's a particularly popular hospital. So there was an impact. However, that was only one factor that was moving at the time. Other factors were favorable for AHN. If you look at the overall share in the Pittsburgh area of AHN among commercial enrollees, those are the ones who were affected by the new contract, it actually is higher in 2023 than it was in 2018 and 2019 leading into the agreement. So the net effect is that AHN is doing better in the most recent year of data, 2023, than it was before that agreement. So there was an impact, but it was not materially adverse in its totality. Second, Highmark Health, the parent entity, does have the ability and incentive to sustain AHN. Mr. Holmberg spoke to the ability, which is that Highmark Health is financially sound, so I'll skip over that and get to the incentive portion. AHN in Western Pennsylvania is the closest competitor to the much larger UPMC. If it didn't exist, the dependence of health insurers on UPMC would be even greater. That would create bargaining leverage on the part of UPMC. Economic logic and research shows that as a hospital system like that faces less and less competitors, it's able to negotiate higher prices. Avoiding that outcome of greater dependence on one provider system and creating a stronger competitive alternative, including, but not limited to Highmark, the strategic benefit of improving their bargaining leverage and allowing them to negotiate lower prices. That's good for insurers, it's good for Highmark Health, it's good for Highmark, the insurance entity, and ultimately, by keeping prices down, it's good for consumers and employers in Western Pennsylvania. So when you look at the incentive of Highmark Health to sustain AHN, you have to count both the operating gain or loss that it realizes in any given year, plus the strategic benefit that it gains from having a viable competitor to UPMC and the other Western Pennsylvania hospitals. Last point I want to make is that increased competition benefits consumers. We have two effective integrated delivery systems in Western Pennsylvania. We have other freestanding independent insurers as well as independent hospital systems, and they're all competing. Among all of those, only one is subject to the 2013 conditions. Competition is good. It makes firms work hard to grow their sales, find new and better mousetraps to play them in the market. Leaders want to firms that are not the leading firms want to copy the leaders and try to catch up. The leader wants to innovate and move forward to try to protect its lead. This is sort of a competitive race, and that's what benefits consumers over time. In that competitive race, if you slow one of the racers, to maybe overstretch the analogy, then you're going to diminish competition. As I alluded to at the outset, that can be warranted if there's a good, sound policy basis for doing so based on specific concerns. The two specific concerns at issue in the 2013 order were a lack of insurance competition, and that is greatly reduced. And then second, concern over AHN's condition, or the concern over West Bend's condition, and with the success of the AHN system, that is also now eliminated. So the overall landscape today is completely different, and the concerns that motivated the conditions in the order are now alleviated, if not gone. Thank you.
Interested in you talking a little bit more about the antitrust settlement and the second blue bid, because as I recall the second blue bid, and you mentioned how other companies like Elevance could come in, but I think the second blue bid is really limited in the number of employers that it applies to nationally and within Pennsylvania, certainly within Western Pennsylvania. So, I mean, I'm curious just your scope of reference when you talk about the second blue bid and bringing in a lot of competition, because there's a limited number of employers to compete over in that case.
Sure, but excuse me. So that's correct. It's the largest employers though, so it's a limited number of employers, but it's a large number of enrollees. So so PNC would be an example of a large employer in the Pittsburgh area, and while it's only one employer, it's thousands and thousands of employees. So because the second blue bid applies to the large self-funded employers, it's impacting a large portion of the commercial business, even if it's not a majority of the specific individual employers.
How many are in Western Pennsylvania that are on the list?
How many blue entities or how many large
How
employers?
many of the large employers
I don't know.
are in Western Pennsylvania?
I don't know.
You talked about the sustainability of AHN. And at first it sounded like you were going down one path, but I think financially sustainable means reliance on Highmark, kind of all things staying the same. Is that what you meant in terms
In
of?
2018 and 2019, it had an operating profit, so it may or may not become profitable, have an operating gain in any given year. I'm not able at all to disentangle COVID from other factors over the last couple of years when the operating losses have been larger, but it may be able to become profitable. But I was referring to the overall system. Yes.
The continued contributions of 200+ million.
Yes.
Have you done an analysis whether the removal of the conditions would maintain or improve competition?
Only the logical point that if they have an impact and they're restraining one of the competitors in Western Pennsylvania, then they're having an effect of diminishing competition.
But not specific to this case.
Correct.
Okay. So is it your opinion that currently Western Pennsylvania's insurance and provider markets are highly concentrated?
They are. Insurance is above the threshold for the definition of a highly concentrated market in the merger guidelines, and I believe Medicare Advantage may not be, and it also depends. There's new thresholds as of December 2023, so it may depend on the old versus new thresholds. In that respect, though, it's not unique. Pretty much the entire country, the hospital side or the insurer side, is going to have 3 to 6 large firms, and I'm very much generalizing here. So that's just the degree of economies of scale in both hospital systems and insurance tends to lead to a moderate number of large firms, and that then you exceeds the thresholds for the definition of a concentrated market.
And that's just to be clear, the Department of Justice and FTC 2023 guidelines, the merger guidelines, is that what you're talking about? In terms of the concentration, the AHHI score, which I think they moved up to 1800. Do you know what it is in Western PA for either the insurance or the provider market?
Not with an exact number. It's the HHI is computed as the sum of squared market shares. So if you have a couple of firms at 25%, 25 to 30% as you would in Medicare Advantage, then you're going to get about 3 times 625. So it's going to be in the 2000 range, which is over the new threshold of 1800, below the old threshold of 2500. And commercial insurance, I think, is higher.
And I think same question as Mr. Holmberg. You mentioned Medicare Advantage. You mentioned the growth of companies that were already there. I'm talking about companies that want to come in. And when they say they look for rate, they say the rates are unrealistically high from providers that they can't come in and get contracts in Western Pennsylvania to begin to compete. Would be curious your thoughts on that response.
So, I mean, United was almost entirely out in 2013 and 2014. So they'd be a counterexample. So you can see in the written comments that their enrollment share was near zero at that time. Now they have about 50,000 Medicare Advantage enrollees in Western Pennsylvania. So that may be a counterexample. Aetna was already here, and then they've just grown substantially over the ensuing years. I don't have specific knowledge of someone, Medicare Advantage insurer, who tried to enter and was unable to, and I don't know whether they were which provider system, whether it was all of them that was difficult for them to contract with.
Any questions? Yeah. Any good questions? No. Thank you very much.
Thank you.
Next up, we have Susan Manning and Margaret Guerin Calvert with Compass Lexicon.
Morning. My name is Dr. Susan Manning. I am testifying today along with my colleague Margaret Guerin Calvert as the principal authors of the competitive assessment of the Western Pennsylvania Insurance and Healthcare Markets Report prepared for the Pennsylvania Insurance Department, which was issued in May 2023 and reissued in January 2024. That report, which I'll refer to as the 2023 report, and early reports and this testimony reflect the professional opinions and assessments of the authors and not necessarily of Compass Lexicon or FTI Consulting as a firm or its individual professionals. The department requested that Compass Lexicon conduct a 10-year re-examination and updated developments and trends in the Western Pennsylvania healthcare insurance markets and healthcare delivery markets under the department's approving determination and order dated April 29, 2023, as amended. In this testimony, I'll refer to that order as the 2023 order and the conditions under the 2023 order as the conditions. As you may know, the department published on its website the 2023 report and our two earlier reports issued in 2013 and 2017. Also included in the department's website is our letter in response to the issues related to Highmark Health's request for modification submitted in March 2024. Given the time permitted, I will summarize certain of our conclusions from these reports and other observations. We encourage anyone who has not already had the opportunity to review these materials to do so. Briefly, we'll summarize our three primary conclusions, which are based on our extensive review of the healthcare insurance and provider markets in Western Pennsylvania. First, it is our conclusion that the 2023 order's competitive and public interest conditions appear to achieve their purposes of preserving and protecting competitive dynamics while not placing Highmark or AHN at a competitive disadvantage. We have not identified any economic evidence in the data and information provided to us or through public sources as that these conditions have impaired Highmark's and Allegheny Network's ability to respond to material changes in competitive conditions. Highmark's Health's ability to request waivers to these conditions when necessary provides a safeguard for Highmark to respond to changing competitive conditions. Highmark has made waiver requests and waivers have been granted by the department. The potential for anti-competitive harm that we found in 2023 remains. Market factors that pose potential competitive risk include the concentrated healthcare insurance and healthcare provider space in Western Pennsylvania and the predominance of Highmark and UPMC and their increasingly similar vertical structures. These vertical structures can lead either to diminished competition when they accommodate each other's strategies or intense competition. Other factors that exacerbate potential competitive risk include the circumstances arising from the removal of restrictions via the Blue Cross Blue Shield Association antitrust settlement and the Highmark UPMC insurer-provider contract. The competitive conditions were designed to mitigate potential adverse effects on competition, and these factors can create the potential for anti-competitive harm and the likelihood and incentive for anti-competitive conduct. Second, as we expressed in our 2017 report, we conclude that the 2000 order, including its competition and public interest conditions, have had no adverse effect on healthcare insurance, healthcare delivery, or the quality of care and variety of healthcare plans available to Highmark members or other healthcare consumers in Western Pennsylvania. Third, we conclude that competition within the Western Pennsylvania healthcare insurance marketplace has strengthened since 2017, and healthcare delivery services competition in Western Pennsylvania, that is inpatient, outpatient physician services, is strong as compared with the level of competition present before the 2013 order and under the conditions as set forth in the order. Highmark has lost membership from 2013 to 2021, as we described in the 2023 report, but most recently, Highmark has been regaining membership as it continues to develop new and innovative network products to use in competing for members. UPMC is a formidable competitor of Highmark in the overall insurance sector, although the two competitors tend to focus on different health plan products. In Western Pennsylvania and Commonwealth, there remains a national insurer presence, which includes United Healthcare, Aetna, Cigna, among others. On the healthcare delivery side, Allegheny Health Network provides a viable competitive alternative to UPMC for Highmark members and other Western Pennsylvania patients. That said, Allegheny Health Network's patient operations are unprofitable with net operating losses incurred in 2020 through 2023, and Highmark Health continues to infuse Allegheny Health Network with significant capital. Our concerns with modifying the 2013 order, its competition public interest conditions as requested by Highmark Health, take into account the foregoing and focus on the potential vertical effects from the 2013 transaction in terms of the ability to foreclose or diminish competition or raise rivals' costs in competing in Western Pennsylvania healthcare insurance and provider markets. With respect to these vertical competitive conditions, specifically conditions 1 and 2, restricting exclusive contracting, and conditions 5 and 6, prohibiting most favored nation, or as they're commonly referred to, MFN provisions, Highmark Health claims in previous notification to the department that it has no intention to engage in these insurer-provider contracting practices. It also claims that it faces independent oversight for such conduct under the antitrust laws and Pennsylvania and federal laws governing charitable organizations. Such contracting practices have been successfully challenged in courts and are prohibited in some states. However, we are not aware of any general prohibition on such practices in Pennsylvania under federal law governing charitable organizations. If Highmark Health and its affiliated entities intend to engage in such contracting practices, it would seem that Highmark Health and its affiliated entities would not be competitively impacted or harmed or disadvantaged by the existence of these conditions within the order. This is especially true if, as Highmark Health asserts, its rivals face similar constraints under other laws or regulations. Maintaining the 2013 order's conditions against exclusive contracting and the use of MFNs will assure the department and Commonwealth residents that these commitments are kept. Moreover, these conditions are used to protect against potential vertical concerns about foreclosure of competition or raising rivals' costs, particularly as new rivals attempt to enter the healthcare markets in Western Pennsylvania. In advocating for the modification or elimination of condition 3, the 5-year limit on insurer-provider contracts, Highmark Health has claimed that it is reluctant to invest in innovative pro-consumer arrangements with providers because it cannot obtain an appropriate return on investment. According to Highmark Health, this condition poses particular competitive disadvantages for Highmark because other payers may enter into these long-term contracts necessary for risk or value-based arrangements, while Highmark must request a waiver in advance from the department, which can cause significant delays in negotiations. Highmark has provided information to substantiate its claim of being competitively disadvantaged by this condition to the department, as we are aware. That said, studies have shown that long-term insurer-provider contracts, which do not allow contracts to adjust to changing market conditions, can have anti-competitive effects. This was a key concern articulated by the Department of Justice in its review of the Highmark West Penn Allegheny Health System transaction in 2013 and evaluate in the department's review of the transaction. We acknowledge seeking waivers and conditions can take time. Should the department decide to make a change, it may wish to consider some modifications to the 2013 Orders Condition 3 to address the waiver delay, but with the proviso that insurer-provider contracts exceeding 5 years should incorporate a market adjustment mechanism to ensure that neither the insurer nor provider become competitively or financially disadvantaged over time. With respect to firewall provisions of conditions 7, 8, and 9, we strongly disagree with Highmark Health's position that the federal price transparency rules have equivalent effect of the 2013 orders firewall provisions, thus mooting the need for these conditions. The federal price transparency rules require group health plans and insurers to publish provider-specific reimbursement rates. These rules do not prohibit the transfer of rivals' competitively sensitive information along the vertical chain. That is, from Allegheny Health Network, the provider, to Highmark, the insurer, or vice versa. Such information transfers have the potential to diminish competition among rivals and raise rivals' costs with adverse effects on consumers. The firewall conditions, as effectuated in Highmark's published firewall policy and enforcement provisions, are useful to protect against potential adverse vertical effects, such as foreclosure or raising rival costs as new rivals enter the market. We understand that Highmark Health agrees that the 2013 Orders Condition 20, which prohibits anti-tiering, anti-steering, is pro-consumer and pro-competitive, and it prevents artificial and unnecessary inflation of healthcare costs. We understand that Highmark Health and its affiliated entities have not included, and Highmark Health claims that none of these entities will include anti-tiering or anti-steering provisions in insurer-provider contracts. As such, we do not see how Condition 20 would cause Highmark to be competitively disadvantaged. Maintaining Condition 20 will assure the department and healthcare consumers that these commitments are capped. With respect to Condition 21 relating to Highmark members' admissions at other community hospitals, the condition addresses concerns expressed that Highmark's affiliation with Allegheny Health Network could potentially result in Highmark steering its members to Allegheny Health Network and away from community hospitals. Such steering would cause considerable financial harm and volume losses to these hospitals. This condition requires Highmark to report on the impact of the integrated delivery network strategy with respect to these community hospitals. We understand Highmark Health considers this condition to be unnecessary because other payers also have significant membership volume at community hospitals. Highmark Health views the reporting and monitoring standard of this condition to be a burden that constrains it from designing and offering products that would be in the best interest of policyholders and subscribers. We are aware that smaller and independent hospitals in Western Pennsylvania and across the Commonwealth face significant financial viability and other challenges today. Many community hospitals have either closed, continue to struggle, or have sought affiliation with or buyout by larger healthcare systems. Given the challenging environment, this condition provides the department with additional transparency with respect to the area's largest insurers' patient volumes at community hospitals, which ultimately compete with Highmark's own hospitals. We have not identified any evidence that this reporting or monitoring has had an adverse competitive or financial effect on Highmark, and therefore we do not see an economic justification for eliminating this condition. Community health reinvestment Condition 23 requires Highmark to continue its commitment to nonprofit health activities for the betterment of overall community health care. Under the order, Highmark must dedicate 1.25% of its aggregated direct written premiums towards CHR activity and report such funding to the department. With the modification request, Highmark Health recognizes it has a commitment to the community and a statutory obligation to report CHR activities. However, it states that no other Pennsylvania payers are required to pay a specific dollar amount for community health reinvestment. We note that other regulators across the country have required 5-year or longer financial investments in community benefit programs in similar transactions where there have been competitive concerns about insurer and provider market concentration. Our analysis of the competitive conditions in Western Pennsylvania do not indicate that either Highmark members or competition in the area have been adversely affected by Condition 23. With respect to Highmark Health's position that consent orders with similar conditions expire after 5 to 10 years, which position appears to be primarily based on consent orders cited in our 2023 report. In our review, we have determined that there is no hard and fast rule for how long such orders stay in effect. Rather, the issue is context dependent. And the context in which both provider and insurer markets are concentrated with two large vertically integrated firms, existing and potential vertical competition concerns weigh in favor of continuing the 2013 order. Highmark Health also maintains in its modification request that it is the only insurer entity subject to these competitive and public interest requirements. At the time of Highmark Health's request, it may have been true, but since then, we understand the department has imposed similar competitive and public interest conditions on Kaiser Permanente transaction with Geisinger Health, citing competition, the public interest, and the fact that the condition is pro-competitive and consumer welfare enhancing to the residents of Pennsylvania. To summarize our competitive concerns with Highmark's request to modify the 2023 order, it is our overall conclusion that competitive and public interest conditions remain necessary to strengthen and maintain competition in both the health insurer and health provider market sectors. But for the 2013 order, there may exist an increased risk of potential anti-competitive behavior in the concentrated healthcare insurance and provider sectors, and with the exacerbation by long-term contract between UPMC and Highmark, and these rivals increasingly symmetric vertical structures. Specifically, as we stated in our 23 report, with two large and more symmetrically vertically integrated healthcare delivery and financing networks competing against one another in Western Pennsylvania, competition can take one of two forms: intense competition or tacit collusion, or more specifically, diminished competition. It is also important to emphasize that we have not conducted an analysis, nor have we ever stated or concluded that if the 2013 order's competitive and consumer conditions were terminated, competition in Western Pennsylvania would remain robust to the benefit of Highmark members or of care consumers. To the contrary, it is our opinion that the available evidence indicates that the 2013 order and its competitive and public interest conditions continue to serve to mitigate potential adverse competitive effects. Thank you.
Thank you. I mean, reasonable people can disagree, reasonable economists can disagree. Your reports in Dr. Capps, there's actually a great deal of similarity in certain areas on competition, competitive dynamics, but you reach very different conclusions. I'm interested in your thoughts on why.
Let me start with maybe the areas of agreement to emphasize. I think there are 2 or 3 that are really important, which is starting from the period prior to the 2013 order to today. There is an agreement that the market has moved in a stronger competitive position, particularly AHN compared to where it was prior to the order has certainly strengthened after the transaction and grown in a significant way. And that there also is a situation where it is a stronger competitive rival with UPMC as well as with others. So agreement there. There's also agreement that there has been in the insurance provider section, the insurance sector, a expansion on the part of rivals and also in terms of UPMC. So overall, a strengthening of the competition between that, and that those are 2 things. There's an agreement, which I think we heard emphasized today, that the market structure, however, has remained concentrated as measured by HHIs or other standard measures of concentration in both the insurance and in the provider sector, the hospital sector, for example. And both of those factors, in terms of that market concentration remaining, are significant ones that were a concern back in 2013, remain a concern in 2023. What has also evolved though, is where again, there's an agreement that there is a significantly larger, 2 large vertically integrated entities, UPMC, Highmark AHN, which are the predominant players in each of the insurance and the provider sectors with large shares in each. So there's agreement about that. And there's also an agreement with the status quo, with the conditions in place, that there are significant constraints on the kinds of contracting practices that can be used. And there are, as a result, dynamics that continue to benefit and have benefited consumers in the area. Where we disagree, and I think to go directly to answer your question as to why we reach such different conclusions, is I think, again, three areas. One is in looking at those structures, we also took into consideration on this issue as to the incentives for the two main vertically integrated systems to compete with each other, as opposed to more tacit coordination. We do note that there's the long-term UPM contract with Highmark Health, which could align incentives, is one aspect. But we also did a comprehensive review of each of the conditions and how it is that they serve to benefit competition. So that's one area. I think the biggest areas of difference, going back to that vertically integrated structure, the continued market concentration structure, is we looked at and consider that there are significant potential antitrust risks from that were the conditions not to be present. As Susan said, we did not look in detail at the for world, but we did evaluate what would the risks be and the impact on incentives and likelihood of anti-competitive conduct. And there we note that conditions such as the firewall one, which limit the ability to share information about rivals, is one that really has been a significant constraint. So we do look at what happens where there is an increased incentive. The potential entry from Blue Cross Blue Shield or other kinds of entities is an additional factor or pressure. So those are the significant areas of difference where our assessment is that the conditions, without the conditions, and with this current structure and conditions, there's a potential risk for anti-competitive conduct with the types of contracting practices or other elements that are prohibited.
I have nothing to add.
Interested also in your thoughts on the potential impact of the Blue settlement and what that could mean.
I'm positive.
The Blue settlement, interested in your thoughts on the antitrust settlement.
I'd say this is an area of agreement that it has the prospect that additional entrants will be actively considering Western Pennsylvania and expansion in other parts of the Commonwealth. The impact for the issues with regard to the conditions is that our concern is that without the conditions, there is the prospect that either of the major rivals could consider actions that would limit that entry or foreclose that entry, so that there might be some incentives and likelihood that could in the prospect of that potential for more significant entry, could encourage anti-competitive conduct that might, if were it to occur, would be to the detriment of consumer welfare and the Commonwealth.
So effectively, you could use a most favored nation clause in anti-tiering, anti-steering provisions to almost box out someone like Elevance from being able to come in and develop a adequate network to compete.
The concern about the use of those provisions generally, most favored nation, exclusivity, yes, is that could be something that could either partially or more completely affect, or alternatively raise their cost of entry. Either one of those will want impact that is there of MFN exclusivity.
Would that be, I mean, that seems like one of the reasons behind the antitrust settlement in the first place. If they were to come back in and effectively box out other blues, I mean, is that consistent with the spirit of the settlement?
I might have misinterpreted. So as a general matter, if the purpose of the settlement is to enable open competition, then something that would have the effect of significantly undermining the ability for that to occur is the kind of thing that would be, I think from our perspective in this context, a competitive concern.
And potentially removing those conditions would open up that scenario, theoretically.
Theoretically, yes.
Theoretically, it raises that. There's also, like with regard to the firewall, is a concern that by being able to transfer information across entity, you could get access to information.
Sure. And I mean, you see firewall requirements for groups like in CVS, you see it in Cigna, in ESI. I mean, you see it obviously here to limit the opportunity to share competitive information. So I think that makes sense. Your thoughts on Medicare Advantage market specifically? Obviously, it's growing. We have a number of applications for different areas of the state by a number of almost on an annual basis. Well, on an annual basis, we get handfuls that all try to come in before April 15th or whatever the federal deadline is. But I've heard from a number of companies that would like to expand across the state and or come into Pennsylvania for the first time that again, Western Pennsylvania is hard to get into. It's hard to develop contracts because you have the two integrated systems and their prices are higher than what a new entrant could participate in if they don't have the heft of a UHC potentially behind them. I think we all know UHC is one of the largest health insurers in the country. So that's a little bit different than kind of another company that maybe wants to come in. Just curious your thoughts on the Medicare Advantage market in particular.
I'd say as a general matter, there is uncertainty, in several markets about Medicare Advantage in terms of reimbursements and so on. I think in the context of what we're looking at here, don't have any specific comments on the, some of those challenges that are being reached, the specific challenges for specific entrants as they're facing. I would say as an overall matter, having the kinds of protections that are there with regard to, say, firewalls, the other contracting practices are ones that inure to the benefit of potential entrants, in that is not something that could further change their costs of entry in a negative way or impact the likelihood of their entry in a negative way.
Yeah, and I mean, I think very philosophically, but structurally, I want to talk about AHN for a minute. You heard the questioning of the prior panelists on whether it could be independently sustainable. I think when you have an integrated system, there are different ways that money moves between different parts of an integrated system. And I mean, you almost like a balloon at times. You push in one side, it can come out the other. You can push in the other side. Curious your thoughts on the substantial contributions that Highmark makes towards AHN, its reliance, AHN's on those contributions, and what that means for the competitive nature in the overall scheme of as we look at the order.
So I would say overall, it is an aspect that we've seen in other integrated systems. I think it, overall from a competition perspective, because I'll leave some of the financials to others. I think from a competition perspective, it makes it, it shows the issue as to how much competition in this marketplace right now in Western Pennsylvania relies on the vertically integrated Highmark, AHN, and the vertically integrated UPMC with its insurance plans and also its providers, and the importance of rivals who contract with them at the insurance level and also at provider level to be able to negotiate new deals, offer new innovative products, and not to have conditions be changed such that it would make that more complicated. So it's a long way of saying to really ensure that this vertical entity has the strongest pressure put on it, not just from UPMC as another vertical entrant, but from the other insurer and provider to really continue to keep it competitive. That will put as much pressure on putting appropriate rates, but also being able to have competitive rates offered to rivals in the insurance particular sector.
The one thing I would add to that is I think that Highmark Health with its investments have made AHN incredibly viable alternative to UPMC, and they should be applauded for those investments. Those investments are necessary because the cost of healthcare delivery in the United States is an expensive proposition. But at the same time, there's advantages to having a vertically integrated firm where those types of transfers of funds can occur from one to other. And it can, in fact, raise the barriers to entry for other insurers or other healthcare providers to enter the market, given the ability to make those transfers. But I will say Highmark should definitely be applauded for what they have done to AHN as far as increasing competition in the healthcare delivery market in Western Pennsylvania.
Thank you.
Other questions?
No, thank you very much. Now I think we'll move into the public comment period. The one that I have registered is Jonathan Greer with the Insurance Federation of Pennsylvania. Jonathan, if you could limit it to around 5 minutes.
Good morning. My name is Jonathan Greer, and I am the President and CEO of the Insurance Federation of Pennsylvania, a multi-line state trade association that includes commercial health insurers as its members. At the outset, we thank the Insurance Department for today's hearing on Highmark's request for modification of the 2013 order that placed conditions on its acquisition of the West Penn Allegheny Health System that's since been rebranded as Allegheny Health Network. We advocated for this hearing as part of our February submission, opposing the request for modification, and are pleased the matter is getting the public attention it deserves. The comment letters Highmark solicited in support of its position characterize the request for modification as a form of deregulation of conditions that are no longer needed. As the department knows well, the Insurance Federation does not make regulation just for the sake of regulation. That said, we continue to share the sentiments expressed in the 2013 order that its accompanying conditions are necessary, quote, to preserve and promote competition in insurance in the Commonwealth of Pennsylvania, to protect the public interest, and to protect the financial stability of Highmark insurance companies, unquote. The department also concluded the imposition of these conditions ensured the transaction did not violate Section 1402 of the Insurance Company Holding Companies Act, a position we also continue to share. In support of its assertion, these conditions have outlived their purpose. Highmark also argues the 2013 order should be dissolved since its conditions now impose what it refers to as a, quote, unique burden, unquote. This raises a question for the department. Is the 2013 order unique? And is it imposing a burden on Highmark? Based on the evidence, the answer to both is no. First, as recently as March 27th, the Insurance Department granted conditional approval to the acquisition of Geisinger Health by Resont Health and Kaiser Foundation Hospitals that, in utilizing the same standard of review that was applied in 2013, witnessed the imposition of more than 20 conditions, many of which mirror those in the 2013 Highmark AHN order. And despite Highmark's assertion that orders of this nature typically terminate after 10 years, Many of these conditions are not time limited, and those that are last for 15 years. Second, with respect to Highmark's quote burden argument, we refer you to the findings of the department's retained consultant, Compass Lexicon, which is part of its 2023 analysis, found the conditions contained within the 2013 order as quote necessary to promote competition and the public interest going forward in Western Pennsylvania, unquote. Compass Lexicon goes on to find, quote, no indication that the 2013 order has had an adverse effect on health insurance, healthcare delivery, the quality of care and variety of plans available to Highmark members or other consumers in Western Pennsylvania, unquote. Further, Compass Lexicon also notes the order's conclusion of a process that it refers to as a quote safeguard for Highmark that it has successfully pursued in the past. We take these conclusions as demonstrable proof the order's conditions have worked well for the affected parties and continue to achieve their intended purpose. It would be remiss if we failed to mention the March 4th, 2024 comments issued by Compass Lexicon in response to Highmark's use of its findings in the request for the modification. Consistent with our February 9th comments, which raised concerns as to what might occur in the absence of the order's conditions, Compass Lexicon reiterates its position that, contrary to Highmark's mischaracterization of its findings, conditions contained within the 2013 order should remain in place in order to, quote, preserve competition and the public interest. For all these reasons, and in the absence of any evidence to the contrary, we continue to see no objective basis to grant Highmark's request. Thank you for the opportunity to speak before you today.
Thank you, Mr. Greer. Same question as I've asked each panelist so far. I'm curious on your thoughts and whether you've heard from any members on entering the West Pennsylvania market and any particular unique challenges they've faced in trying to do that, particular to the Medicare Advantage.
Yeah, when I heard your question, I suspected some of the concerns that you are expressing or come from some of our members, and that the challenges are real. I would echo the Compass Lexicon comments in response to this question that whatever concerns and challenges that are there today, I suspect that they will intensify and they will spread if these conditions are alleviated. It will spread into the commercial market.
Have any other questions for you? You get off the hot seat quickly. Thank you. Thank you, Mr. Greer. Do we have any other, Kathy, do we have any other public comments?
No.
Did anyone register? No? No additional comments. So is there anyone else now who wants to present comments regarding the request for modification? Since no one else wishes to speak, I'll make a few concluding remarks. I very much appreciate everyone being here, particularly those that have had to travel to be here today with us. So really appreciate you coming in town. The department will compile a list of the questions we asked today and ask that Highmark Health submit its responses to the questions by Friday, May 17th. Those responses will be published on our website. As you reflect on today's public information hearing, and this is for both here and those who may be listening on the web stream, additional comments may occur. The department will keep the record open until at least May 31st, the end of this month, in order to give the opportunity to submit additional comments. You can visit our website for information on how to do so. Again, that was insurance.pa.gov. And with that, and not seeing any more in comments, then we will go ahead and close the hearing and we will call it adjourned. So thank you all and appreciate your time this morning.